by an unknown infection following stem cell transplant. Now WPI has reported the presence of XMRV, a discovery that could have potentially changed her fate. 2 decades after diagnosing my first patient and 1 decade after opening a CFS clinic, remaining a self-employed physician has been the best way to continue a search for answers and to provide a place for patients with CFS. In other words, I can't work anywhere else. I have indirectly donated at least $1 million to the cause of CFS in the form of lost potential income. I still participate on Medicare and, where am I? Most major insurances and follow a large group of patients with CFS and related illnesses. As a small business owner, I cannot provide medical insurance for my staff, and myself was recently declined individual medical insurance by Blue Cross Blue Shield. The clinic generally runs in the red and continues as a service to patients in my community. The effort is subsidized largely by pharmaceutical dollars, since I moonlight doing drug research and consulting to pay my clinical staff. The CDC researchers are still doing epidemiology, deny a viral contribution, and demonstrate little understanding of the clinical subsets that meet the Fukuda CFS case definition. The NIH has not matched research funding to the significance and immediacy of the problem. There is little recognition, interest, or expertise regarding CFS at academic medical institutions across the country, including the University of Utah. As a departing member of the CFSAC, I'm grateful for the chance to represent my CFS patients, to learn the ins and outs of Washington, and to meet many good people who form the committee, and also to hear from many, many patients. Thank you for your dedication and contributions. I'm glad for the progress that's been made. I'm disappointed that the urgent and repeated recommendations of this committee for research funding, clinical care, and CFS education coming from people with the most CFS expertise and experience have largely fallen on deaf ears or have been met with excuses and resistance. I'm disappointed that federal agencies have been underfunded, uninspired, and generally disinterested in this urgent public health problem, and have maintained an undercurrent of disdain not only for those who are ill, but also for those who are trying to help them in the face of dismal resources. I would like to thank all who have been working in the field for the last 20 years, 25, 30 maybe, and I sincerely hope that the discovery of XMRV in patients with CFS, along with other high-quality but largely unnoticed recent biomarker research, will stimulate an explosion of good questions and additional science that will place all the patients with CFS back on the scientific radar and into the mainstream of modern medicine. Thanks for the chance to be here.
Morris? Those are 2 tough acts to follow. I don't know if they can be up to the task, but I do want to thank, I think it was a privilege and an honor to be on the committee for the past several years. I also want to echo some of the frustrations that we've had over the years trying to get things done. But I remember the reason why I was here, and I was here because I wanted to be a patient advocate, looking for answers, looking to see if I can make my patients' lives better in many different ways. While I was in Chicago, I did a lot of that. And when I moved to Connecticut, I was really shocked about how many patients were just showing up at my door saying, "We haven't had a CFS doctor here ever." And so I'm getting patients now from Rhode Island, Connecticut, obviously upstate New York, as well as in Massachusetts and even elsewhere around the country. So it's really an eye-opener that no matter where we go in this country, there are pockets and there are large amounts of patients still out there that need our help, and we just can't stop looking for answers and trying to help these patients. I want to thank the committee members, and I want to thank the ex officio members as well, as they've been real inspiration with their dedication to what we're trying to achieve here. And I want to thank the patients who come here every meeting, and the patients who don't come here every meeting, but who send DVDs and send people come in to speak in their state, and the people who are watching on the web air. Because you keep reminding us of why we're here, and that's important. Thank you.
Chris, if things happen, this might be premature, but
This is Chris.
Oh, I'm sorry. Sorry.
And it's very difficult to follow three very eloquent, articulate voices. I remember as a young physician assistant in a publicly funded community health center in Chicago reading about the yuppie flu and feeling insulted on the behalf of patients that were labeled in such a way. And I didn't have much to do with the chronic fatigue syndrome community until 1999 when I was offered an opportunity to be a part of the Illinois Area Education Health Center's project with the CDC and the chronic fatigue, the CFIDS Association Provider Education Project. Well, my eyes were opened wider, and my heart opened even wider, and it became clear that provider education is such an important underpinning to this whole process. And I was very happy to have been able to contribute to that project and continue as an educator to ensure that the students that I have contact with learn about chronic fatigue syndrome. One of the aspects of healthcare that I think is so important is patient-centered care, and I think that chronic fatigue syndrome unfortunately is an excellent way to teach that to my students and to other clinicians. And I hope to continue to tell your stories, advise my patients about the patient stories that we've heard over the years, and to continue to work with the community to improve the care that will be provided to you in the future. I want to thank everybody on the committee that I've gotten to know over the past years. It certainly never was something that I expected to be a part of, and I feel like I have gained much more perhaps than I've contributed, but I wish to thank you all at all your various levels for all the work that you do, and I appreciate having been a part of it. Thank you.
Okay, before I declare it closed, Wanda, do you want to give us any further instructions or messages?
Well, just to sort of wrap again on the housekeeping and the details, we will be getting all of the submitted testimony, the written testimony, ensuring the 508 compliance, getting that posted as quickly as we can. Keep the CFSAC website bookmarked and watch for the links to the webcast, where then it will be archived, where it can then be viewed later for reference. Share those links widely and help us continue to get the word out. And where you can see places to make improvements, please know that we are here to serve. The call to service is a charge taken very seriously by many of us. And I just sit in awe of people who serve on advisory committees because, you know, having been around these trees more than a few times with advisory committees and knowing, you know, we work you to death for a couple days at a time, sap everything out of you, and send you on your way, and then it feels like we do nothing. But in fact, and I've been in government now over 22 years, and I have seen significant progress in many areas, and many areas it's like a soap opera. I drop back in and good grief, here it is. And I understand that view because I do share some of that feeling that, you know, gosh, we've come nowhere, and yet we've come very far. There's still so far to go. It's an enormous frontier for this disease, for this illness. And this meeting, though, really has been an inspiration. It has been filled with hope, a little fear, but a tremendous amount of encouragement and enthusiasm for the people who continue to do the work, the people who continue to speak out, who continue to, and forgive me, I know I'm the Office on Women's Health and we take our share of heat for this. This is an a female image, but